Press the bell icon on YouTube and don't miss another update.
COVID-19 is an important disease. I don't say it is a fatal disease. It is a fast spreading disease, but the case fatality rate is relatively lower. But in the presence of diabetes, the instances of deaths are slightly more when compared to those without diabetes, and hence the significance of this small lecture. The number one tip will be, if you have diabetes, make sure that you are controlling diabetes appropriately. Measure the sugars at home with your glucose meter more frequently and ensure the glucoses are not above, if possible, not above 180 milligrams per deciliter. Lower the better. Avoid hypoglycemias, and that's below 70 milligrams per deciliter. Number two, in many hospitals, including our hospitals, doctors and the team, they are arranging telemedicine consultations. Telemedicine is proven in diabetes. It is proven in diabetes to bring better outcomes. And in this disaster, I will request all of you to avail the facilities from telemedicine consultations from your hospitals and from your doctors. Even if you cannot have your laboratory results, we can review the earlier results, and then based on projected values, we can make suggestions in your prescriptions. The next tip will be, never be idle at home. Be very active. Be very active. In diabetes, activity is equally important to medicines. Make sure that you are exercising a minimum of 30 minutes per day. In subjects with type 2 diabetes, in children and adolescents, the recommended duration is over 1 hour per day. And don't sit and then work continuously for 1 hour. Just go around for 5 minutes, climb stairs, come down, and then resume your activity. Drink plenty of water is important. Every half an hour, you can sip a small quantity of water. And this is to ensure hydration. But make sure that your amount of fluids matches with the advices from your doctor and the dietitian based on your health of your kidney. In case you develop a fever, it is very common to have a common cold. It is very common to have a mild fever, a sore throat, and a running nose. It need not be COVID. It need not be COVID all the time. Two important instructions that I would like to give you. Number one, if you have an infection, a mild infection, stay at home. You can have paracetamol, you can have an antihistamine, but stay away from children and elderly at home. And the same advices, if somebody is ill at home, then stay away from them. Because with diabetes, you have a relatively lower immunity. And it is to build up the immunity, it is to build up the resistance that we are advising you to exercise daily to ensure that the glucoses are controlled properly, and also, very important, the duration of sleep. 8 to 10 hours of sleep daily. When you are sitting at home, when you are in social distance, when you are isolated, don't be lazy. Wake up exactly at the same time every day in the morning, take a bath, and then be active. And go to bed also at the same time in the evening. Don't keep awake late into the night. And if you have a fever or a sore throat or a joint pain, better not to have ibuprofen. ibuprofen might worsen the existing illness. The next tip will be always be happy. Don't be anxious. I know that many of you are already anxious because we are responding to our patients. Please don't be angry. Relax, be positive, read, listen to the music, dance, and no need to be angry at people. No need to be vengeance at people. Be relaxed. Because when you are angry or anxious, the hormones, and these are the counter regulatory hormones like the steroids, the other counter regulatory hormones, all these anxiety related hormones and catecholamines, they have a tendency to increase glucoses, and they have the tendency to reduce your immunity level. So be relaxed. Be relaxed with diabetes. And I would say that next time when this is over, if you have not vaccinated against pneumococcal pneumonia and influenza, this is an advice which we have published. We have the Indian consensus guidelines, and this is an international consensus existing since many decades, that patients with diabetes belong to the category and they have to get vaccinated against these illnesses. And this, if you have not done, you may do it later when this disaster is over, once this disaster is over. And the last one is on hydroxychloroquine. Hydroxychloroquine is advised for prophylaxis only in those healthcare professionals. And this medicine, which is existing for more than 75 years, originally for malaria, and the government of India for the last 6 years, it has been approved for use in type 2 diabetes daily. So relatively safe drug. But for prophylaxis, your doctor will advise you if you require. Without the advice of a doctor, please don't take it. So the final word for those with diabetes, type 1, type 2 or any type of diabetes, relax. Don't get anxious. But you have to control your diabetes more stringently. You have to exercise daily. You have to sleep properly.